the fluid accumulate after the drain is being removed. So usually when we have such an open dead space, we put a drain in there and we close the skin up, and that drain helps remove the fluid that's accumulated in there as well as the air that's trapped in there. That drain usually keep there for about 2 weeks.
And
once we remove that, some of those fluid may still accumulate. In that case, if patients need to come back, we should give them a little bit of numbing medication, put a needle in there and drain that out.
Or they can get infected, so you have to always watch that.
That's the reason why we want to remove them.
Okay, okay. So there's a risk of some suture infection post-op?
The
Only
suture granuloma, yes, we could see that, but it's rare. It's because the suture we use are absorbable suture, and over a period of about 3 months or so, the sutures are gone.
Now, it's been very popular. Are men doing it as well as women, or more women?
More women, but men are beginning to take advantage of the procedures.
And of all these procedures, facelift, breast reduction, all that, are men catching up? Are they rising in numbers?
They are rising in numbers, but they're probably going to have a long way to catch up with the women population, since they don't have to go through the pregnancy.
And so now the American Society of Plastic Surgeons, they must have noted that there's an increase of all these procedures in the last 10 years. Of all these procedures, which is still the most commonly performed after weight loss?
Most commonly performed after weight loss would still be tummy tuck.
So that's number one.
That's number one.
What about liposuction?
Well, like I said, because they already went through the diet thing, so they don't need as much liposuction.
Okay.
And then the breast lift
would be second.
Would be second.
Okay. And facelifts are done at younger and younger ages, so that's no longer tied to just weight loss.
Right. As far as facelift, it happened to people just due to aging alone. And younger people, even in their mid-30s or late 30s, beginning to come in for just a skin lift. And nowadays they call it short scar lift.
What's a short scar lift?
Just basically you have a scar a little bit anterior in the front of the ear, and just go around the earlobe, but not to the extent that you have to lift the neck to create a scar that you have to hide it behind the ear, go all the way to the hairline.
So when it's a short facelift, it's just the middle face? Or?
It's a little bit of the middle face and a little bit of the jaw area.
Okay.
But not of the neck.
Not of the neck. And that is, people are doing that in their 30s?
Mid-30s and late 30s, yeah.
Mid-30s.
Particularly smokers.
Smokers, okay.
Right, they lose the subcutaneous or the fat under their skin, and they form wrinkle at an earlier age.
At what age do they worry about, like, the upper face, the upper one-third?
I've seen most of the patients who were in their late 30s or early 40s, but those are to the extent that you can take care of that minimally invasive by using Botox.
Oh, with the forehead. Oh, I see.
Right. You can use Botox to lift the brows, so actually they don't need the surgery until they get to their 50s.
So has the number of facelifts decreased because of the advent of Botox, or no, it's still the same number?
It hasn't been decreasing, rather it's just delaying the procedure for most of those patients.
So in the, so what else is new about facelifts and the techniques of facelifts in the last 5 years? Are they doing smaller incisions, different sutures?
Well, there have been development in using, yes, like you said, smaller incision, and we actually use the delivery system that we can actually lift the mid-face without having to make the incision around the ear. But again, those are for the patient, or they call them like contour thread, and they use a thread facelift. But these are for the patient who has mild to potentially moderate sagginess, but not for the patient who have massive, droopiness.
Oh, after massive weight loss.
Exactly.
Okay. So if one were going to have all this done, and let's say a big wedding was planned in a year, in June a following year, and now it is December, you have 6 months. Is 6 months enough time to get all this done and look beautiful for a June wedding if you're mother of the bride?
Absolutely, absolutely.
So you plan for about 6 months?
Well, most of the swelling doesn't go away completely until about a year after the surgery, but most of the swelling started out and peak at about 5 days following the surgery, and it start shrinking down. So by about 3 weeks out, you have seen most of the swelling going down already. And so for those patients, they actually have 6 months for most of the swelling to go down.
So do you think it's better to plan a year ahead if you have a big...
If they have
the time.
If they can plan that ahead, absolutely.
A year
It cannot
is better.
hurt them.
Oh, better.
Absolutely.
Okay, because there could be complications post-op that will delay the swelling.
Again, so we have to select our patients in terms of their risks. If they are smokers, if they have high blood pressure, if they are obese, if they are diabetic. So all of those have to be taken into consideration. So if they said that they have 6 months to go to a function, and if they have all those medical problems, then we wouldn't want to.
You need more time. So let's say you want to be redone for a June wedding, and you either have a choice of 12 months before or 9 months before. And let's say you have no risk factors. You're 60 years old and you have mild hypertension, no smoking, no diabetes. Then what would they start off first with? What takes the longest to heal? The face?
I would say what bother them the
Oh, I
most.
see. Okay.
What bothers them the most. And again, if they need a facelift, if they need to, breast lift, breast reduction, or breast augmentation, they need a tummy tuck,
They can't
thigh
do it,
lift and whatnot.
but you can't-
Not all of those are done at the same setting.
Oh, you can't do it all at the same time?
Right, because
Too
you
much
don't want
anesthesia.
too much anesthesia. So you want to do one procedure at a time.
So how much time do you put in between? 2 weeks? Like let's say facelift, then you wait 2 weeks and do the breast. And
You
then,
could wait about 2 weeks.
But you kind of be in pain. Because you'll be in pain in the face, then you have your breast, and then 2 more weeks for the tummy tuck, so you'll be kind of in pain for 6 weeks.
Right. Otherwise, you'll be spreading your pain out over a period of a year.
Right, right, okay. So let's say you have hypertension and diabetes, but you're not overweight. You're only maybe a little bit overweight, and you have a big wedding June of the following year. So you should probably start consulting your doctors to make sure that you're okay to have plastic surgery.
Absolutely. You should go to see your primary care physician, get referral to your
Right.
cardiologist,
Right.
make sure you have a stress test
Stress test.
showing that your heart is able to tolerate such stress going through the surgery.
This takes a lot of work.
Oh, yeah. But it's just for the safety purposes.
Okay.
You want to be able to have the surgery and be able to go home. You don't want to have the surgery and not waking up.
Now, what heals the fastest? The tummy tuck heals the fastest?
Actually, the face heals faster than
Oh.
the tummy tuck. Just the face is very well perfused, or blood supply to the face is very abundant compared to that of a tummy.
So let's say the face will heal so you can go to work within a month.
Absolutely.
Right. You can wear dark glasses 2 weeks post-op.
Well, the bruising would last about 10 to 14 days. So after 2 weeks, the bruising has already been gone.
So you can wear dark glasses for the first 2 weeks, and you kind of look normal. Wear makeup after this.
Well, but for patients who have facelift, I probably wouldn't recommend them going back to work for the first week,
Okay.
just due to the swelling.
Right. So don't go to work for the first week. The second week, you can wear sunglasses.
Absolutely, sunglasses and makeup.
But if you have a choice and you have nothing else better to do, hide for 2 weeks.
For 2 weeks, yes.
Right. Because after the second week, you kind of look normal.
Right,
Okay. You don't look perfect, but you look normal.
right. You look
can-
close to being normal.
Yeah, close to being normal. So you can hide for 2 weeks, go to a spa, go to a hotel, say that you're visiting all your relatives all over the world, and then reemerge. So after the first month, you can start going to parties and looking good?
I would say yes.
Okay.
I would say I would recommend the patient having surgery